All right. Hi, everybody. Thanks so much for joining us for our first installment of the CRISP Webinar Summer Series. My name is Michelle Rubin, and I'll be your guide through the webinar series. This is an opportunity for you, our users, to learn about CRISP, how we can help you and your patients, and directly interact with CRISP staff. A few housekeeping items. Everybody is on mute. So if you have any questions along the way, please use the chat box on the right. We'll answer them at the end of the presentation and get to as many as possible. We may not be able to get to all questions, so we'll consolidate all of them and post the questions and answers on our website and send them out to this group. This webinar is also being recorded, so if you miss anything, don't fret. We'll distribute the slides for the recording and the Q&A by email and post them on our website, crisphealth.org. Also, please look out for a brief survey. We would be very grateful if you would fill it out so we can improve the series. To help you prepare for the July 1st mandate of using PDMP, today's webinar topic is Prescription Drug Monitoring Program and where you fit in. Our presenter today is Lindsay Ferris, our PDMP expert. Lindsay, take it away.
Thank you, Michelle. So today I'm going to be talking through the mandate. So I'm going to do a quick history and background just for a level setting, talk through the mandated use that's coming up on July 1, and then do a very quick demo of our unified landing page, which has the PDMP search information in there. And then we'll have time for the question and answer, which I'm hoping to have about 15 minutes for. So as quick background, the PDMP is administered by the Maryland Department of Health, Behavioral Health Administration. So they actually run the program, and CRISP serves as the technology for the PDMP and serves as the credentialing and access point for clinical providers. The PDMP mandate bill, which is HB 437, was passed in 2016 legislative session, and I've highlighted kind of 4 major areas that really impact you the most that came out of that bill. First, I'm going to be talking about the use mandate, and that's why that's bolded. That's the focus of today's session today. But did want to mention that that bill also contained the registration mandate, which passed on July 1 of last year, that required prescribers and pharmacists to register with the PDMP in advance of the use mandate. Also, the bill tied the prescriber CDS permitting and renewal process to the registration. So if you are renewing your CDS, or if you are new to the state or moving from a residency to fully licensed individual, then you have to be registered with the PDMP before you start that process. The bill also highlighted the fact that delegates were expanded to include unlicensed healthcare professionals, since it originally had started with just licensed healthcare professionals. So that is an option to use unlicensed, office staff, etc., to access the PDMP on your behalf. And also, the PDMP data submission was increased to occur every 24 hours instead of the 3 business days, which it currently is at. This hasn't been changed yet. We're still having the reporting happen every 3 business days, but the regulations are being promulgated currently, and so we should see that change happen to every 24 hours in the fairly near future. Some quick definitions. A prescriber is anybody that has the authority to prescribe controlled dangerous substances in Maryland. It usually means an individual DEA and CDS. You could also be a resident or an intern that prescribes underneath an organizational DEA and CDS. A pharmacist is licensed to dispense prescriptions within Maryland, and then a delegate could be a licensed healthcare professional or an unlicensed healthcare professional who's employed at the same professional practice as the delegator. Now, the use mandate requirements for pharmacists, because it actually breaks it into 2. There's one guideline for pharmacists, and then there's another guideline for prescribers. The pharmacists are required to review the PDMP if the individual that they're dispensing the controlled substance to, if that pharmacist believes that it's for a purpose other than for their medical condition, they're required to look at the PDMP information. For prescribers, They're required to review 4 months of PDMP data, which the system is set up to already default to allow you to see more than 4 months. Generally, it loads all of the PDMP data, and that needs to occur before you're initiating a new opioid or benzodiazepine prescription, or every 90 days if that prescription and course of treatment is ongoing beyond 90 days. And then when you do check the PDMP for that information, you must document that the PDMP was reviewed within the patient's chart. So if you're in your electronic health record or your chart for the patient, you have to document the fact that the PDMP was checked. There are some minor exceptions to that, but it generally will require that you document that in your medical chart. And for those exceptions, it's for when we're delivering PDMP data directly into an electronic health record, and it's stored in the electronic health record, which there's kind of a handful of organizations that are doing that today. There are exemptions to the use mandate requirements, so I've got 2 slides kind of listing through the exemptions. The first set of exemptions really kind of has to do with the patient themselves and the circumstances of that patient. So if you're dispensing or prescribing for a day's supply that's 3 days or less, you do not have to check the PDMP. And then other kind of settings and circumstances of that patient, if they're being treated in an inpatient hospital or setting where the controlled substance is being administered to the patient in that setting, then you don't have to check the PDMP. If you're diagnosed with a terminal illness, or the patient's diagnosed with cancer or cancer-related pain or acute pain following a series of surgical procedures or significant trauma, childbirth, etc. The definition of each of these will be defined in the regulations when they get promulgated, which again, they're in process. Now the other series of exemptions kind of relate to external factors. So if the accessing of the PDMP would delay treatment or negatively impact the patient's medical condition, then you do not need to check the PDMP. If there's electronic access is not operational, as determined by the PDMP program, which I think is mostly getting towards the PDMP's operational state. If it's not operational, then you would not have to check the PDMP. And if the prescriber cannot access it individually due to a temporary technological or electrical failure within your site, then you would not have to, that is also an exemption. But if one of these occur, it does say that, use reasonable medical judgment when deciding prescribe or dispense, and document in your medical chart for the patient why the PDMP was not accessed. There's also one other exemption that's listed, that the secretary can add drugs that have low potential for abuse to a specific list, and then those would be exempt. I don't believe that there's anything on that list today, but that is a possibility in the future. Finally, some questions have come up around compliance, and we have been working with the Behavioral Health Administration to kind of put some parameters around that. So as a reminder, the PDMP program itself does not have the ability to enforce compliance. They'll monitor the compliance and general utilization compared to the dispenses coming in, but compliance really lives with the licensure boards. And we have been informed that the licensure board enforcement will largely just be complaint driven, as it is today in other circumstances. So if there's a complaint that's filed with the licensure board, then they will look into it, and if it's related to checking the PDMP. That's largely how compliance will be enforced in any sort of way. We are working with the state to provide tools to clinicians through the unified landing page for providers to understand their own utilization, just as general information, and to understand how your prescribing habits are compared to peers, just kind of some insight into your own prescribing patterns and accessing the PDMP information just for your own kind of tools. Now there's a series of ways to access the PDMP data itself. With the unified landing page, it's a web-based portal, so it's external to your electronic health record. It does require an individual username and password to be able to log into that, and that includes with your delegates. Your delegates would have to register with CRISP on their own and get their own username and password, and then we will connect the two of you together through the registration process. And then we also have a Delegator Dashboard that we're going to be that we actually just released yesterday to allow delegators to manage their relationships with their own delegates within the unified landing page. And just as a reminder, please log in once every 90 days to keep your login active. It's a security measure that's a general industry standard that if you haven't logged in every 90 days, then we'll lock your account and you'd have to contact CRISP to unlock that. And then there's also a couple other ways to access the data that's available as an option. We have deeper electronic health record integration. So that could be in one click is what we call it, single sign-on, where with one click from within your electronic health record, it will log you into our system, pass along the patient information, and you'll land on the patient's chart in the PDMP data with that single click. There's also zero-click integration, which we refer to as in-context alerting, and we are able to essentially embed the PDMP information within your electronic health record in a way that it appears as if it's part of the chart, but isn't actually stored there. And there's also the option to deliver the PDMP data that's not listed here. There's there's an agreement that would have to be signed for us to deliver PDMP data to be actually stored in your electronic health record, but that is an option. We've also have integrated with Dr. First, which is an e-prescribing tool, and that would allow you to see the PDMP data during your e-prescribing workflow. So now I'm going to move to a demo of the unified landing page. I'm going to pull this over. I'm logged in as myself, and I'm going to pull up a patient, just a test patient, in our test environment, and search for that patient. And, oh, that's why. I'm in the wrong system. So I'm going to log in as myself. And upon logging in, I'm going to search for that same patient. And when I search for the patient, it'll come back. In this case, it only matched with one single person. And I'm going to go ahead and click on the PDMP to view the PDMP information for this patient. And in this view, you can see Maryland information will load below. We also have an interstate sharing set up. Right now it's displaying 4 of the neighboring states. Because we're in our test environment, it's actually not set up to query out and pull back that information. That's why you're seeing that red bar there. But in production, or in our the site that you'd be going to, you could see that information load and it'll appear in the same exact screen. And the screen just allows me to view the PDMP history for the patient. It's defaulted to sorting on the date filled. You can change that sorting option. You can do that for any column. You can also choose to filter. So if you only want to focus on one particular drug, you can apply that filter and just view that information. And that, again, goes for all of the columns listed here. And then we have some extra information that's available, like the pharmacy name and address and the prescriber name and address as well. Please also note that the interstate sharing is only matching on the first name, last name, and date of birth. And so please use your discretion when you're viewing the information from a state that is indicated outside of Maryland. It might say, West Virginia or Virginia, DC, because the matching is using just very little information, and it doesn't go through the rigorous matching process that the Maryland data does. Now I'm going to go back to our slides, and actually that link just launched that again. And I also wanted to mention that the Delegator Dashboard is an option. So the Delegator Dashboard allows for delegators to manage their own delegates. I unfortunately can't demo it today, but it is available to delegators in the system. When you log in, you can search on your delegate in this search bar. So if you start entering that person's name, it'll pop up a list of list of individuals that match that could serve as your delegate. And you select that name, and then it'll show add delegate, and if you have your list of delegates that you've already added, then you can decide to remove them at a later time if you'd like. So it just gives you a way to manage your own delegates within the portal, as opposed to having to contact CRISP every time. And then when the delegate logs in and they search for a patient to pull up PDMP information, they'll be asked to select who they're querying on behalf of for that particular patient. So they will find your name as a delegator and assign essentially that query to you. So now we're going to open up to the Q&A session. If you could enter your questions in the chat box, and we can walk through those. I will try to get to as many questions as possible, and if we aren't able to get to all of them, don't worry. We will consolidate all the questions that were asked and answered, and any questions that remain unanswered, and we will assign an answer to it and send it out to all the participants listening in today and post it on our website as well. So the first question that came in is, what is the best way to get the support staff registered for practice so they can be delegates? Does each individual provider need to select the delegate, or can this be added on your end? So the delegate does have to be registered with CRISP before you're able to find them in the Delegator Dashboard. So they would do that by going to our website, crisphealth.org. There's a button that will direct you to register with us, and they go through the same process or similar process to what you all went through, where they have to authenticate their identity and put in basic information, complete a training, and then we will register and credential them for access. Then they will be available, and you would be able to manage your relationship with that delegate through the Delegator Dashboard yourself. The second question that came in is, can a patient opt out of PDMP? The answer is no. And it is a little tricky of a thought, but CRISP, as a health information exchange, does allow opting out of information that is coming in under our participation agreement, but is not mandated by law. If there's something mandated by law, like a program like PDMP, the patient's not allowed to opt out of that data. So even if they opt out of the clinical information that's being contributed to CRISP, you cannot opt out of the PDMP data, and the PDMP data will still display. The third question is, if you access data through the electronic health record PDMP instead of your own personal unified landing page login, does that satisfy the compliance requirement? The answer is yes. So if the ways that we've integrated the PDMP into electronic health records, it's generally a real-time call out to our system, and it passes your information to us. And so we will know this person is querying for the PDMP data. You've already done the registration step, and so we know that you are registered and allowed to see the PDMP information, and we will return that to you, and that is contained within our audit history, and we will know that you have satisfied that mandate. Similarly, if you have a delegate going to the unified landing page, for example, and querying on behalf of you, when they specify who they're querying on behalf of, we track that in our system, and we know that essentially you or one of your delegates have accessed the PDMP and satisfies the compliance requirement. The one exception to that is if we are delivering PDMP data directly into the electronic health record such that it's stored in there, and any access of that information is looking at that data that's stored within the electronic health record, then that audit history lives within the electronic health record, and we technically wouldn't know, but it's still meeting the compliance requirement. It's just that source of the information will have to be provided by the institution to any sort of requirement to view the audit history instead of CRISP, but it still meets the compliance requirement. The fourth question was, what about out-of-state pharmacies with unlicensed Maryland pharmacist staff that review the prescriptions? It is my understanding that they are not mandated. So out-of-state pharmacies, I'm assuming that you mean Maryland pharmacist staff, somebody with a pharmacy license. If you're dispensing in another state to, even if it's a Maryland resident coming into another state like DC, for example, to get a prescription filled, the mandate really follows the geographic region, right? So the mandate occurs in Maryland. If you are dispensing, if you're a dispenser located in Maryland dispensing drugs, then the mandate applies. If you are in DC, physically located in DC, then the mandate does not apply. And please let us know if I did not answer that correctly, because I'm filling in some assumptions. So another question is, does a doctor have to do this personally, or can a nurse? You can absolutely delegate access to the PDMP to meet the compliance requirement. You would designate the nurse or anybody else that you'd like to serve as your delegate as your delegate, and then that delegate would log in and say, I'm querying for the PDMP data on behalf of this prescriber, and that would meet the compliance requirement. So we do encourage you to do that, especially if you're using the unified landing page. So another question is, why have there been several patients on controlled substances that are not showing up on CRISP? So this could be due to a number of different reasons. We really need examples like that. If you come across something where you expect there to be a controlled substance but there isn't, please contact us. We'll need to get the patient information to be able to trace it back. Some of the potential reasons that we've seen before is maybe a prescription was written, but it wasn't ever filled and therefore dispensed, and therefore reported to the PDMP, since the PDMP is based off of dispensed prescriptions only, not those that are written. And so another reason could be maybe there was a transfer issue between our PDMP vendor collecting the information and getting to us so that we can display it within the PDMP, or potentially there's something else that's happening. There's just a lot of different reasons that could occur. So we appreciate whenever you reach out to us and let us know, and we can look into it. Another question is, will PDMP show all drugs prescribed or only controlled drugs? So the PDMP only displays collects controlled substances Schedule 2 through 5. So it's only the controlled drugs that fall into those schedules that you will see in the PDMP. Will all pharmacies be required to report to CRISP? So the PDMP itself requires all dispensers. That could be a pharmacy, or it could be a prescribing dispenser, and that the prescribing dispensers or pharmacies are required to report the information to CRISP, to the PDMP itself. And that happened actually when it first was enacted as a PDMP, so that should already be happening. We technically should have 100% coverage. Other than some of the exemptions that are listed in the legislation, there are some circumstances where you do not have to report dispensed prescriptions to patients, or to the PDMP. Next question is, can we do the query on the patient prior to their appointment, and will that count? So if you run reports, for example, early in the day for all incoming patients, so that is readily available for the provider during the day, and will that satisfy the compliance requirement for that patient, or must it be done in real time during the prescriber action? So you can pull that information prior to the appointment. We have been looking at what's the common kind of window period for that. It might be the day before, maybe if it's on a Friday and they're coming in on a Monday, there could be several days that pass, but it's really only one business day. We are going to look at all of those different time windows, but it satisfies the compliance requirement as long as you are looking at the PDMP ahead of writing that prescription. We do recommend to try to do it as close as possible to the date that you're actually interacting with the patient, because new information could file into the PDMP that would be beneficial for you to see. Next question is, where can I contact you with specific patient examples? That is a great question. So actually, I have a slide So if you need technical PDMP support, you can contact us here. We have the email and phone number. Now, please do not send us protected health information for patients through an unsecure email. What we prefer is if you contact us and say, hey, I'm missing some PDMP information here that I think should be there, and then we'll reach out and get the information to you by phone. So another question was, can you give us more information on the new overdose alert? We are going to actually walk through that in our next webinar session, which is next Wednesday on the 27th. So I encourage you to join us there, or if you need to listen to the recording afterwards, that will be available as well. But basically the overdose alert is we're capturing any overdoses that occur within an emergency department for the majority of the hospitals in Maryland, DC, and West Virginia. It's looking at overdoses that are for specific codes, so ICD-10 codes largely today. And anytime it kind of meets one of the definitions of a potential overdose, we're storing that information, and when you go to view the PDMP information, we can show you that that person had prior histories of overdoses. It also displays the date that they occurred, the location, and what diagnosis code caused that overdose to be filed and flagged as an overdose, a potential overdose. Another question is, how do these regulations apply to pediatric neurologists who routinely and frequently prescribe benzodiazepines to children with epilepsy? Are we required to query PDMP for every prescription? I think this is getting a little bit beyond what I feel comfortable answering. Unfortunately, I wish I could, but I will take this question to the Beamer Health Administration, and if we need to pull in some more clinical folks, and just get a response to you through the Q&A mailer that we'll do and post to our website. So I make sure that I'm answering your question appropriately. Another question is, do you have a list of EMR vendors that have portals that satisfy the PDMP data pull? So if you're asking about the vendors that we've integrated with the PDMP data into, we have integrated with Epic, Cerner, and Meditech. I'm sure that there are some others in there. We can make sure that we get a complete answer when we send out the answers to the questions for today's webinar. But we have successfully integrated with a number of different vendors and using different approaches for each, because each vendor is a little bit different, so we might have to approach it slightly differently. Another question is, if a prescriber sees multiple prescriptions for controlled substances for patients by multiple prescribers, should the prescriber contact the other prescribers about their concerns, and should CRISP be notified? So you don't need to notify CRISP. I'm not sure I feel fully comfortable answering that. It's more of in the clinical realm. I do not want to pretend to have the answers to clinical type questions. I will see if we can talk to some clinicians and the Beaver Health Administration and PDMP program and see if they have any insight on kind of best practices around that, and we can get back to you on an answer. Another question was, someone asked about when meds are not listed, and mentioned that the prescriptions from methadone clinics are excluded because of 42 CFR Part 2. So that is accurate. I was saying earlier about how some dispensers are exempt from reporting to the PDMP. One of them are like methadone clinics or any substance use treatment facilities, because there's a federal rule, 42 CFR Part 2, that that does not allow you to share any information, including just fact of treatment, unless you have explicit consent from a patient. And so it's been generally exempt from all PDMPs. I actually don't know of any PDMP that collects that information. So that any sort of treatment or fact of treatment or the drugs itself would not be available or reported to the PDMP because of that rule. Then we had a question about, will we integrate with Practice Fusion? I'm not sure if we have yet, but I will check on that and we'll get that response out with the questions when we send out the answers. So I think that concludes the questions that we've seen come through so far. We'll make sure that we summarize all the questions, and if we missed any, we'll do another pass and make sure that we have all of them accounted for. And if you know of anyone who missed today's webinar, a follow-up email will be sent out again to the link to the official CRISP Health YouTube page where you can subscribe and follow all of our seminar webinar series. We thank you very much for joining today, and we hope to see you next week when we talk more about PDMP functionality and overdose alerts.